that kind of like what he's talking about, if we're not just robots, you know. Of course, we're not going to like, well, you're so mad and now I'm so mad, you know, but kind of just recognizing basically countertransference is just the feelings that come up in the therapist, which is a human emotion.
Yeah, and I'm sure you two would agree, but the field has advanced a lot when we're not just the blank slate sitting behind,
for sure,
writing down what they're saying.
Totally.
You know, it's like my therapist always tells me, you are the best tool you have access to in the room. Right?
Yeah.
Keep it sharp, keep it healthy, keep it ready to use.
I love that.
Yeah, she's great. Her name's Sharon. She's wonderful.
Thanks,
I
Sharon.
love her to death.
Shout out Sharon.
Yeah. And you guys practice in what city with the couples therapy?
Primarily Garland. We do a lot of virtual. We don't really have an in-person office because we just moved to Garland recently, and then had a couple of kids. So virtual is a space that we fit in pretty well right now.
Sure. Yeah. Is there visions to eventually expand this and get into some of those roles?
Absolutely, yes. Probably not when we have 2 under 2.
Yeah, I mean, this is recent. You have a 2-year-old and a 2-month-old. Congratulations, by the way.
Thank you.
Yeah, you guys were talking about them messing around with each other a little bit before. I won't get too deep into what you guys were joking about, but it's funny. Kids are funny.
It is. They are hilarious. Yeah. So I mean, it's kind of a lot to balance. I mean, you know, because like what we mentioned earlier, we both have our individual careers kind of in totally separate fields from marriage counseling. And then we're able to do this, couples counseling, and then we're able to do this on the side as well, you know, whenever we can, when life permits. That right now, you know, we have our personal life is pretty crazy.
Yeah, you guys are busy.
Yes.
Is it married couples that you're working with a lot? Do you guys do premarital therapy, things like that, or just haven't kind of gotten into that yet? Or
We haven't gotten to. We would love to. We talk about doing premarital all the time.
We want to write a book for premarital
You should.
counseling.
We really haven't had any come across yet.
Yeah.
You
Just
two
couples in
do.
general,
You guys have a unique dynamic and perspective as 2 married therapists. It's like you should write a book.
For sure.
Yeah. And then
One day,
when
that's
you
on the
do,
list.
One day.
We'll bring you back on to talk about it.
Yeah.
when you
There
do.
we go.
Yeah.
We'll grow the humans, and then we'll write the book, and then we'll get our PhDs. And
One day at a time. Yeah. So what kind of compels you guys to further this? And I know we've kind of touched on this a little bit, but people are always kind of jumping in and leaving and coming back, so they might have missed. But what compels you guys to work with the couple to break down these dynamics? What are they getting out of this when they come and sit down with you guys?